Welcome to all my viewers. This is Dr. Ajay Kumar. Today we are going to talk about sciatica. Sciatica एक बहुत ही आम बीमारी है जो प्रायः मिडिल एज ग्रुप में पाई जाती है। ओल्ड एज में भी यह बीमारी पाई जाती है और इस बीमारी में पैर के एक नस में दर्द होती है जिसे साइटिक नर्व कहा जाता है। यह नस जो है हमारे वर्टिब्रल कॉलम लंबर से स्टार्ट होती है, लंबर रीजन से यह ओरिजिनेट करती है एंड फ्रॉम देयर इट रन्स थ्रू द हिप डाउन टू द नी वेयर इट ब्रांचेज ऑफ डाउनवर्ड्स and runs down to the foot. When there is inflammation in this nerve, the disease of sciatica or the condition of sciatica is generated. इस बीमारी का मुख्य कारण जो है वह हमारे स्पाइनल कॉर्ड में, वर्टिब्रल रीजन में, हमारे वर्टिब्रल कॉलम जो है उसमें छिपा हुआ है। मुख्य रूप से हर्निएटेड डिस्क, जब हमारे जो वर्टिब्रल कॉलम होते हैं, रीढ़ की हड्डी जो होती है उसकी बनावट इस तरह से होती है। दो हड्डी के बीच में एक डिस्क होता है। वह डिस्क जब स्लिप कर जाता है, जब नीचे की ओर उतर जाता है या ऊपर की ओर चला जाता है, दोनों कंडीशन में क्या होता है कि जो नर्व वहाँ से ओरिजिनेट होती है उस नर्व पे कंप्रेशन पड़ता है। तो जो नर्व में जब कंप्रेशन होता है जिसके कारण उस पूरे नर्व्स में आपके कमर से लेके पैर तक उसमें दर्द की शिकायत बन जाती है। दिस इज द रूट कॉज ऑफ साइटिका। किसी किसी केस में हमारे ग्लूटियल रीजन में एक मसल होती है जो पिरिफॉर्मिस मसल होती है, उसमें भी स्पैज्म होने से इस बीमारी का जन्म होता है। उसे पिरिफॉर्मिस सिंड्रोम के नाम से जाना जाता है। दिस डिजीज इज ए मैनेजेबल डिजीज, इट इज ए क्यूरेबल डिजीज एंड in homeopathy we can treat this disease very with very ease and there is a great success in homeopathy. Dear friends, homeopathy runs on the principle of holism. So there are several medicines which has the capability to cure it, but only that medicine can cure this problem which will suit to the individuality of that person. So every medicine has certain individuality and we have to match the individuality of the medicine to the individuality of the person. Once it is matched, the medicine works very fantastically and you can cure the disease. There are several commonly found medicine, commonly used medicine in sciatica like Rhus, Colocynth, Magnesium Phos. There are several other medicines. I will not talk about those things. I will share my approach in the cases of sciatica. How we'll treat sciatica with a command, with a grip, with a surety. That is the basic thing that we are going to learn here. देर एक लेडी का केस शेयर करते हैं। इसमें लेडी की उम्र करीब 48 ईयर्स की है एंड शी हैज बीन सफरिंग फ्रॉम this sciatica problem for long time and उसमें हम लोगों को यह देखने को मिलता है कि वो लेडी को जो दर्द होता है वो पैर में, वो दर्द कभी भी हो सकता है। इसका कोई फिक्स्ड टाइम नहीं है। वो जाड़ा में भी होता है, गर्मी में भी होता है और ख़ासकर जब वो कुछ ठंडा चीज़ खा लेती है, जैसे खीरा दही ये सब खा लेती है, तो उसके दर्द काफ़ी बढ़ जाते हैं। उस उसे ज़्यादा देर बैठने के बाद चलने में दर्द होता है। कुछ दूर बहुत दूर भी वो नहीं चल सकती है। और जब उसे दर्द होता है तो काफ़ी तेज दर्द होता है। वो पूरा पैर को खींचती है, तीरती है, and she stretches the leg a lot, and she presses it. Many a times she has a burning sensation in the in the sole, and there is so much heat in the sole that she wants to run out of the house to find a cool place, and she washes her foot, and she becomes very restless at that time. Many a times she feels a lot of heat in the body, whole body, and at that time she wants a very cool place. This happen mostly in summer, but in the winter also she had some episodes of heat flushes in the feet, and and at times she had a very cramping pain in the calf muscle, in the leg. She becomes very restless. She folds the knee to the chair, and many times she stretches it forward, backward. Anyhow, she wants to get relief. When we went into history, we find that the problem had started after delivery, and when I went deeper, I found that she had a history of abortion, and near around that the problem had started. uh, she has three children, and uh, um, and the rheumatic problems. She had a certain other rheumatic problem also, like shoulder pain, and it all started after delivery. The pain was mostly in the left leg, and by the body constitution she is a bit tall, but she doesn't have a lot of flesh on her body. uh, a bit we can say that she is non-fleshy lady, uh, and she desires rice, she desires uh, uh, yogurt, curd, cucumber, but all these things usually um, aggravate her problem. So in this case, we have to understand how to go for the case. How should we analyze the case? That is very important. Here, dear friends, in this case, what I observed that the case had been originated ever since she had delivery, and more particularly, she had underweight under uh, gone abortion. अबॉर्शन के बाद ही उसके प्रॉब्लम ये हुए हैं, और कंबाइंड विद द हीट फ्लसेस, शरीर में इतनी गर्मी है कि वो भाग जाना चाहती है, वो बाहर जाना चाहती है, वो कूल प्लेस चाहती है. And what is the manifestation of the disease? The manifestation of the disease that is of the sciatica is that she stretches, she presses. वो पैर को खींचती है, तीरती है, फोल्ड करके कुर्सी पे रखती है, and she is not getting relief by any how. वह कहती है, she says that when she walks, when she starts after sitting, the pain is aggravated. बैठती है तो थोड़ा उसको ठीक रहता है, लेकिन जैसे ही चलती है उसको दर्द बढ़ जाता है, लेकिन वो बहुत चल भी नहीं पाती है. So here we have a modality that sitting aggravates, long sitting aggravates our problem, and And she basically she is a lean constitution, and she desires a lot of cold things for the stomach. So here, if we go by the whole journey of the disease, we will find that the disease has started from abortion. The constitution is lean. There is heat flushes in the feet. There is a heat in the body, and the patient desires cold things in the stomach. And she stretches, she cramps the leg, and she tries to press the muscles. All these goes in the favor of secale cord. And in this case, the secale cord was prescribed. After 2 or 3 doses of secale cord, the lady was perfectly okay. Almost 1 year has lapsed, and she never recounter re-encounter this the episode of sciatica. She is very much satisfied. We have to distinguish it here with Rhus talks. What modality of Rhus talks is? Rhus talks has the modality of aggravation after long sitting or long rest, and the patient becomes restlessness with the stiffness, and when he starts moving, with the initial moving, the pain is aggravated, but as he moves on, all the pain relieves. But here in this case, what the lady is telling, she is telling that after initial movement is painful, but she cannot move along a lot also. So here Rhus talks is contraindicated. And moreover, the Rhus talks also has desire to stress. Rhus talks stretches to clear off its stiffness. It's want to get rid from the stiffness, but this lady doesn't complain of any stiffness. So here we have to understand the difference of Rhus talk stretching and the stretching of secale cord. Secale cord stretches very hard. It stretches its limbs very hard, and it stretches because of the neuralgic pain, the neuralgic cramps. The neuralgia of secale cord is much more pronounced than Rhus talks. And moreover, in Rhus talks, you will find that Rhus talks is very chilly person, and Rhus talks is ameliorated by warmth, where secale cord is it appears cold. It if you touch him, he is cold, but inside secale cord is very hot, and that's why secale cord has a lot of heat inside, and that's why it he desires for cold thing to eat, cold thing to drink, and he desires cold atmosphere. Colocynth also is a very important medicine for sciatica, but colocynth will see that it is ameliorated by pressure. It desires a lot of pressure, and in this case, only pressure was not enough. Uh, there is a stretching also in colocynth. You will seldom find that sort of a stretching. So colocynth was not indicated in this case. Another medicine is that also comes very near, that is Magnum Phos, and in Magnum Phos you will see that there is a neuralgic pain, and in that neuralgia the patient is very restless. The pain is of very cramping nature, unbearable nature, and in that case the patient is relieved by pressure as well as a warmth. So where the ameliorated by warmth application, uh, uh, Magnum Phos is much more indicated than any other things. I had a case of very old person, about 70 years of age, when he had a sciatica, and he talked me on phone that he is very in very painful condition, and no medicine is helping him. He was almost on the verge of crying due to pain. And when I got took the case, I found only two modality that was very important in that case. That is was very sensitive to pain, and the pain was ameliorated by warmth application and by pressure. So in that case, Magnum Phos was given in 1 potency, and the case was cleared within 7 days. And almost 2 years have lapsed. He has never encountered the second attack of sciatica. So this is this way. If you practice homeopathy in the case of sciatica, I do feel that sciatica can be cured very easily. Thank you very much. If you feel that this video helps you, do like, do comment, do share, and do subscribe my channel. Thank you very much.